semak kan. Tak payah reply lah. Nak reply pun tak sempat. Aku reply tadi. Nak enter tak enter. Okay, bye. Kejap. Okay, start.
Boleh mula. Assalamualaikum warahmatullahi taala wabarakatuh. Selamat tengah hari, selamat sejahtera. Selamat datang saya ucapkan kepada semua peserta webinar kita hari ini. Terima kasih sekali lagi saya ucapkan sebab sudi luangkan masa tengah-tengah hari macam ni untuk dengar kita punya talk webinar. Dan insyaAllah kita akan bersiaran lebih kurang dalam 1 jam. Jadi sebenarnya kita boleh tengok bersiaran langsung di YouTube rasmi PPUM sendiri ya. Dan sebenarnya unit makmal kardiologi sepanjang minggu ini sedang mengadakan Minggu World Heart Day peringkat PPUM 2022 dengan tema Use Heart for Every Heart. Dan ada beberapa aktiviti yang telah yang akan kita jalankan, dan seperti contoh daripada hari Isnin sehingga hari Khamis ni kita ada webinar seperti hari ini, dan kita ada 2 soalan kuis setiap sesi webinar. Jadi selepas habis sesi webinar ni saya akan bacakan 2 soalan kuis dan boleh hantarkan jawapan ke Facebook rasmi kami iaitu di cardiology_UMMC. Dan sekarang juga masih berlangsung di Concourse, kita ada pameran poster, dan insyaAllah hari Jumaat nanti kita akan adakan majlis perasmian di Auditorium Menara Selatan. Dan kepada yang baru masuk, selamat datang lagi saya ucapkan. Terima kasih banyak-banyak. Jika ada sebarang soalan ataupun pertanyaan ataupun pandangan ataupun pengalaman tentang apa yang kita akan bincangkan pada ini, boleh dropkan soalan anda di Q&A sebab kita sediakan Q&A session nanti, dan boleh dropkan soalan di Q&A. Kita ada Q&A ruang yang boleh. Nanti saya akan cuba bacakan dan kita minta panel kita untuk bincangkan. Dan kalau semalam ya kita dah bincangkan topik tentang diet Mediterranean. Menarik sebenarnya. Macam mana diet Mediterranean ni kita olah, kita gubah dengan cara orang Malaysia in Malaysian way. Dan hari ini kita akan bincangkan tentang satu topik yang berkesinambungan dan berkaitan juga tentang diet, iaitu tentang masalah berlebihan berat badan ataupun obesity. Dan sebenarnya ya, masalah berlebihan berat badan ni dan obesity ni sebenarnya meningkat pada kadar yang sangat membimbangkan di Malaysia, dengan 1 daripada 2 orang dewasa mempunyai masalah berat badan berlebihan. Bayangkan di sesuatu kawasan atau sesuatu tempat, separuh daripada orang tu adalah mempunyai masalah obesity. Dan bagi kanak-kanak pula, 30% daripada mereka yang berumur di kalangan 5 hingga 13 tahun mencatatkan masalah obesity. Dan dianggarkan seramai 3.5 juta penduduk di Malaysia disahkan mengalami obesity. Dan hal ini sebenarnya ya berkait rapat dengan faktor pemakanan dan gaya hidup kita yang tak sihat. Dan menurut statistik daripada Kajian Kesihatan dan Mobiliti Nasional NHMS pada tahun 2019, Malaysia mempunyai kadar obesiti dan berat badan yang paling tinggi di Asia Tenggara. Bayangkan ya, dekat Asia Tenggara kita nombor 1. Pada saya ini bukan satu pencapaian yang boleh dibanggakan lah, sebab ia melibatkan kesihatan rakyat Malaysia sendiri. Dan apa sebenarnya obesiti ni? Kita dengar sana obesiti, sini obesiti. Obesiti ni sebenarnya adalah pengumpulan lemak yang tidak normal dan secara berlebihan dalam badan yang boleh menimbulkan risiko kepada kesihatan. Dan sebenarnya obesiti ni telah dikategorikan sebagai penyakit ataupun dia lebih kepada penyakit yang tidak berjangkit. Dan obesiti juga adalah faktor risiko utama bagi beberapa penyakit kronik, termasuk penyakit kardiovaskular. Dan sebenarnya banyak faktor penyumbang kepada masalah obesiti ni, bukan semata-mata kepada saiz pemakanan kita sahaja. Contoh, saya boleh katakan perubahan hormon seorang itu contoh wanita ya, seorang wanita itu menghidap PCOS, dia boleh mengalami penambahan berat badan ataupun mungkin disebabkan faktor genetik, faktor keturunan, dan yang tak dapat disangka lagi adalah gaya hidup pemakanan kita yang tidak sihat lah, boleh menyumbang kepada masalah kenaikan berat badan ni. Dan untuk itu, bagi membincangkan tentang masalah obesiti ni, kita akan bersama-sama dengan Profesor Dr. Zulkarnain Jaafar, pakar perunding perubatan kesukanan di Jabatan Perubatan Kesukanan Pusat Perubatan Universiti Malaya. Berkepakaran di dalam sport medicine, lifestyle medicine, musculoskeletal medicine. His work broadly focuses on physical activities and exercise medicine as well as musculoskeletal medicine. His interests are in improving the health, fitness and quality of life of all population. Both the general and athlete population has conducted research on musculoskeletal injuries and prevention, exercise intervention, exercise and technology and molecular studies of sedentary and obese individuals. Jadi, tanpa membuangkan masa, kita saksikan rakaman video.
Assalamualaikum warahmatullahi wabarakatuh and a very good afternoon to everyone. Thank you for participating in today's event in conjunction with World Heart Day 2022. I am Associate Professor Dr. Zulkarnain Jaafar from Sport Medicine Department. My presentation today entitled I Think I'm Obese, What to Do and Who Can Help. To start off, we need to understand what is obesity and how you define obesity. Obesity is defined as excessive fat accumulation that can put our health at risk. This issue has grown to epidemic, with over 4 million people dying each year as a result of being overweight or obese, according to the Global Burden of Disease 2017. Rates of overweight and obesity continue to grow in adults and children. From 1975 to 2016, the prevalence of overweight or obese children and adolescents aged 5 to 19 years old increased from 4 to 18% globally. Obesity is once considered a problem only in high-income countries, but now it is dramatically on the rise in low and middle-income countries, especially in urban settings, just like in our country. As can you see in the graph situated on the left side, Malaysia has the highest prevalence of obesity among the Asian countries. Next to us is Brunei Darussalam. Apart from that, our country also has a high obesity risk, which is about 8/10. And we also have childhood obesity risk of 7.5/11. As you can see, women has a higher risk of obesity and overweight problem as compared to men, while boys has obesity and overweight problem in comparison to girls. However, those who are overweight are at risk of getting into obesity. Hence, in the later future, the obesity numbers would be increasing further because of high overweight prevalence. To understand further the issue of obesity, we need to know how do we measure obesity. First, we use BMI-based classification. Body Mass Index, or BMI, is considered the most practical way to evaluate the degree of obesity. However, it is not a measure of body composition. BMI correlates with cardiovascular disease and also all-cause mortality. BMI is calculated from the height and weight, with the formula body weight in kilogram divided by square of height in meters. For the BMI classification, the WHO uses two different classifications. One is for the general population. The other one is Asian population. As you can see that WHO uses the cut-off point of more than 27.5 kilogram per meter square for obesity in the Asian population. And in the general population classification, the obesity group are divided further into grade 1 obesity, grade 2 obesity, and grade 3 or severe obesity. To better evaluate our body composition, we use bioimpedance analysis machine to evaluate a person's weight by breaking it down into its core component, which are fat, protein, minerals, and body water. It describes your weight more accurately and provide a better glimpse into your overall health than traditional methods such as BMI. Another method that can be used to measure obesity is waist circumference and waist to hip ratio. Waist circumference and waist to hip ratio are surrogate estimations of visceral adiposity, which is linked to serious non-communicable diseases. Waist circumference is used with BMI for identifying adults at increased risk for morbidity and mortality, particularly in the BMI range 25 to 35 kg per meter square. Abdominal obesity is defined as waist circumference in men more than 102 cm or 40 inches, and in women more than 88 cm or 35 inches. Meanwhile, for the waist to hip ratio in men, it is more or equivalent to 0.9, and in women, which is more or equivalent to 0.85. Patients with abdominal obesity are at increased risk for heart disease, diabetes, hypertension, dyslipidemia, non-alcoholic fatty liver disease, and have higher overall mortality rates. So, what is the risk of obesity? What are the health risks that can be faced by obese people? What about the morbidity and mortality among the obese people? Since obesity is a disease associated with a significant increase in mortality and many other health risks, the higher the body mass index is, the greater the risk of morbidity and mortality gonna be. The relationship between BMI and mortality is likely to be similar in all races and ethnicities. But the minimal BMI where excess risk seen may be different from one to another. There are many conditions that are related to obesity complication, namely the cardiometabolic conditions, as well as increased systemic inflammation and endothelial dysfunction, heart failure, atrial fibrillation, and also sleep disorder. This is to name a few. Since high adiposity leads to many health risks, so it is important for obese people to reduce weight. So, what are the importance of weight loss? The benefit of weight loss include a reduction in the rate of progression from impaired glucose tolerance to diabetes, blood pressure in hypertensive patients, reduce C-reactive protein concentration, improve endothelial function and lipid levels in high-risk patients. Other non-cardiac benefits of weight loss include reduction in urinary incontinence, sleep apnea, and depression, as well as improvement in quality of life, physical functioning, and movement. In view of these risk-benefit factors, it is advisable for the obese people to get treatment or help. However, how do they go about? The obese patient should undergo an initial risk assessment. The risk assessment will categorize the patient into low risk, middle risk, or high risk. This assessment will lead to the selection of treatment depending on the category of risk the patient has. The first category is little or no risk. A BMI of 20 to 25 kg per meter square is associated with little or no increased risk. There are exceptions in conditions such as where the waist circumference is high or the person has gained more than 10 kg since the age of 18 years old. However, the Asian individuals will start to have a higher risk even at this low range because BMI more than 23 kg per meter square is an overweight category in Asian classification. The second category is the low risk. Individuals with a BMI of 25 to 29.9 kg per meter square who do not have risk factors for CVD or other weight-related comorbidities may be described as having low risk, particularly if they are older. They should receive counseling on prevention of weight gain, including advice on dietary habits and physical activity. Next is the moderate risk category. Individuals with a BMI between 25 and 29.9 kg per meter square and with one or more risk factor for cardiovascular diseases such as diabetes, hypertension, dyslipidemia, or patient with a BMI of 30 to 34.9 kg per meter square are at moderate risk. Such patients should be referred to multi-component behavioral interventions, which include strategies to make dietary changes, increase physical activity, and weight loss maintenance. Pharmacologic therapy should also be considered for patients in this category. Last is the high-risk category. Individuals with a BMI of 35 to 40 kg per meter square are at high risk, especially those ages between 20 to 39 and those with a BMI above 40 kg per meter square. Individuals in the highest risk categories should receive the most aggressive treatment, intensive multi-component behavioral intervention, pharmacologic therapy, as well as bariatric surgery. When managing the obesity problem, we need to have treatment goals. The goal of treatment is to prevent, treat, or reverse the complication of obesity and improve quality of life. Health benefits have been reported with weight loss of as little as 5% of body weight, and many patients who require weight loss goal of 30% or more is often not achievable without bariatric surgery. In trials comparing pharmacologic therapy with placebo, weight loss of 5 to 10% using both drugs and behavioral intervention is considered a very good response, and weight loss exceeding 10% is considered as excellent response. Hence, it is helpful to understand the expected weight loss with any given intervention in order to align with the patient's goal. In the initial management, individuals would experience the weight loss process through a comprehensive lifestyle intervention, which is a combination of diet, exercise, and behavioral modification. All patients should receive counseling on diet, exercise, and goals for weight loss. The behavioral modification component facilitates adherence to diet and exercise regimes and includes regular self-monitoring of food intake, physical activity, and also weight. Many types of diets can produce modest weight loss. The preferred diet must contain energy that is below the energy expenditure. Options include balanced low-calorie, low-fat, low-calorie, moderate-fat, low-calorie, or low-carbohydrate diets, as well as the Mediterranean diet. Dietary adherence is an important predictor of weight loss, regardless of the type of diet chosen. Metabolic studies using state-of-the-art techniques have concluded that most adults will lose weight when they fat less than 1,000 kilocalories per day. Thus, even subjects who are concerned that they are metabolically resistant to weight loss will lose weight if they comply with a diet of 800 to 1,200 kilocalories per day. Exercise is another important component of lifestyle intervention. Increasing energy expenditure through physical activity is a strong predictor of weight loss maintenance. In addition, physical activity can attenuate the loss of lean mass during active weight loss. Physical activity should be performed for approximately 30 minutes or more, 5 to 7 days per week to prevent weight gain as well as to improve cardiovascular health. The exercise can be done either using the moderate intensity aerobic activity or vigorous intensity of aerobic activity. It appears that there is a relationship between those effects for physical activity and weight loss, and much greater amounts of exercise are necessary to produce significant weight loss in the absence of a calorically restricted diet. Therefore, when weight loss is the desired goal, a calorie-restricted diet should be combined with less sedentary time and increased physical activity. The activity should be gradually increased over time as tolerated. There should be progression in terms of the physical activity. An exercise program that includes aerobic and resistance training is always preferred. Another factor is behavioral modification or behavioral therapy. The goal of behavioral therapy is to help patients make long-term changes in their eating behavior by modifying and monitoring their food intake, modifying their physical activity, and controlling stimuli in the environment that trigger eating. These concepts are usually included in programs conducted by psychologists or other trained personnel as well as many self-help groups. For the subsequent treatment, especially for patients who are unable to achieve weight loss goal with a comprehensive lifestyle intervention alone, options include pharmacologic therapy, the use of medical devices, or bariatric surgery. Drug therapy is often helpful in the treatment of obesity. It can be considered for those with a BMI more than 30 kg per meter square or a BMI of 27 to 29.9 kg per meter square with weight-related comorbidities who have not met weight loss goal, which is loss of at least 5% of total body weight at 3 to 6 months with a comprehensive lifestyle intervention. The decision to initiate drug therapy should be individualized and made after a careful evaluation of the risks and benefits of all treatment options. When a decision has been made to initiate pharmacologic therapy, single agents are preferred over combination therapy. In addition, the choice of anti-obesity drugs depends upon patient's comorbidity, but also takes into account patient preferences, adverse effects, and also costs. In terms of using devices or surgical option in managing the obesity, there are several types of devices which are approved. The use of one of these devices may be considered for use in those patients whom medication are ineffective or not tolerated, and also for those patients who are unable or unwilling to undergo bariatric surgery or as a bridging therapy prior to bariatric surgery. In referring a patient to receive one of these devices, it is important to note that the BMI indication for each device is different, with a BMI range between 25 to 55 kg per meter square. A few examples of devices and surgery used in managing obesity are laparoscopic adjustable gastric banding, electrical stimulation vagal blockade systems, intragastric balloon system, gastric emptying aspiration system, hydrogel, and also bariatric surgery. However, the body appears to have a set point of adipose tissue mass, and strategies that assume the effective treatment of obesity is only a matter of an individual willpower may lead to repeated failure due to the body tendency to revert to its set point. Bariatric surgery, which may alter the body adipose tissue set point, and extended use of anti-obesity pharmacologic therapy may help address these underlying physiologic changes. There are a few therapies that are not recommended while managing obesity. First one is the liposuction. Removal of fat by aspiration after injection of saline has been used to remove and to contour the subcutaneous fat. While this can result in a significant reduction in fat mass and weight, however, it does not appear to improve insulin sensitivity or risk factor for coronary heart disease. The negative energy balance induced by decreased nutritional intake and removal of visceral fat are necessary for achieving the metabolic benefits of weight loss. Another therapy which is not recommended is the dietary supplements. Although over-the-counter dietary supplements are widely used by individuals attempting to lose weight, it is not advisable to use these substances because evidence to support their efficacy and safety are limited. Examples of dietary supplements such as ephedra and ephedra alkaloids containing mahuang, a group of ephedrine-like molecules found in plants, which has been removed from the United States market because of safety concerns. The third therapy which is not recommended is acupuncture. Even though acupuncture has been studied for the treatment of obesity, while most studies have been uncontrolled trials, results from some but not all controlled trials have shown modest benefit of acupuncture for weight loss. However, the majority of these controlled trials are small, of short duration, and do not include adequate placebo controls. For the summary and recommendations, all patients who would benefit from weight loss should receive counseling on diet, exercise, and goal for weight management. Consumption of a reduced caloric diet, frequent self-weighing, and participation in a lifestyle intervention program are strategies to help maintain weight loss. The decision to initiate drug therapy should be individualized and made after a careful evaluation of the risk and benefit of all treatment options, lifestyle, pharmacologic, and also surgical. Candidates for bariatric surgery includes adolescents and adults with a BMI more or equal to 40 kg per meter square or a BMI of 35 to 39.9 kg per meter square with one serious comorbidity who have not met weight loss with intervention such as diet, exercise, and drug therapy. That's all from me. Thank you very much.
Siapakah itu? Siapakah itu? Okey, terima kasih Prof. Atas perkongsian itu tadi.
Sama-sama.
Jadi, apakah macam mana dengan penonton kita? Kalau ada soalan, bolehlah tulis dekat Q&A. Okay, kita ada soalan sebenarnya. Okey. Berkenaan dengan pesakit jantung, Prof. Macam mana kalau pesakit jantung tu yang dia ada masalah obesity juga. Contoh dia nak lakukan physical exercise. Macam mana cara physical exercise dia? Adakah berbeza dengan pesakit jantung yang tak mengalami obesity?
Okey, terima kasih atas soalan yang sangat bagus. Alright. So basically kalau seseorang pesakit obesity yang mengalami masalah jantung, apa yang perlu kita lakukan adalah satu, kita kena buat assessment dia terlebih dahulu. Okey, assessment di mana tahap manakah severity obesity dia tadi. Yang kedua, jenis penyakit jantung apakah yang pesakit alami. Okey, for the time being apa yang kita buat adalah after kita dah evaluate pesakit tersebut, kita kena tengok secara keseluruhan how much is dia punya cardiac function. Kalau cardiac function dia tu not bad, kita boleh proceed dengan aerobic exercise lah. Untuk pesakit jantung biasanya kita akan mulakan dengan low intensity terlebih dahulu. Low intensity, bila dia orang dah boleh adapt, baru kita akan progress dari segi mungkin kita tambah dari segi duration dia. Okay, once dia okay kita akan maintain. Bila dia dah dapat cope dengan that type of intensity, kita akan tambah lagi progression dia supaya ada improvement in term of fitness level. Apa yang kita tengok adalah lebih kepada VO2 max atau fitness level. Untuk pesakit jantung biasanya kalau VO2 max dia kurang daripada 4 max, maksudnya dia tak boleh nak keluar, tak boleh bangun daripada katil pun. Memang dia bedbound normally lah. So untuk pesakit macam tu memang kita minta diorang exercise on bed. Kena buat juga lebih kepada macam upper limb untuk bagi ada contraction of the heart supaya ada pengaliran darah ke bahagian-bahagian badan yang lain. Okay, once dia orang okey, dia orang akan sit up dan buat exercise tu, dan kita daripada situ kita akan tambahlah progress dia orang tu. Okay, so dia actually bergantung kepada severity of the patient dan juga severity of the obesity tadi. Tapi kalau memerlukan rawatan tambahan seperti penggunaan ubat-ubatan, then kita boleh suggest juga lah untuk pengambilan ubat-ubatan tersebut lah. Okay.
Okay. Dari segi senaman macam mana Prof? Mungkin yang bukan on bed lah. Dia boleh lakukan jugalah senaman-senaman.
Senaman-senaman boleh dilakukan. Kadang-kadang ada fisio yang boleh tolong. Sebagai contoh macam cardiac physio, patient boleh duduk di katil dan dia menggunakan arm ergometer. Arm ergometer untuk increasekan dia punya upper limb punya muscle, at the same time akan ada increase contraction of the heart akan menyebabkan better blood circulation. If patient are able to ambulate, then kita suruh dia orang buat walking. Okay, dia orang buat walking. Okay, tambah dari segi progression dia. Once dia okay, kita akan tambah dengan ada activity lah normally. Sebagai especially yang aerobic training. Okay, aerobic training tu ada banyak contoh yang kita boleh buat lah, seperti macam kita buat light jog kan, slow jog dekat satu what call it, at the same place, tidak perlu berlari untuk jogging ke apa, tapi dia slow jog pada satu place untuk increasekan dia punya heart rate tadi. Okay, the intensity can be very mild. Duration mungkin we start off dengan 5 minutes. Bila dia dah okay sikit, dia boleh maintain dengan 5 minutes, kita tambah 10 minutes, and then dia akan increase the progression lah. That's the low intensity. Bila dia orang dah improve, dan kita akan increase dia punya intensity to moderate intensity lah. Normally untuk pesakit jantung, kita maintain at the moderate intensity. Moderate intensity tu dia bergantung pada heart rate kita. So kita kena tahu macam mana kita nak bezakan antara low intensity dengan moderate intensity ataupun high intensity. Kebiasaannya kita akan measure daripada heart rate kita. Kita menggunakan formula 220 minus age. Katakan seseorang tu umur dia 20 tahun. So 220 minus 20 is 200. That's maximum heart rate. Okay, tetapi kalau kita nak katakan low intensity about 30%. So 30% kali dengan maximum heart rate tadi yang 200 tadi. Okay, itu kita dapat dia punya low intensity. Kalau kita nak dapatkan moderate intensity, mungkin kita nak 60%. So 60% daripada maximum heart rate, 60% kali 200 tadi. So dia dapat moderate intensity. Bila kita buat exercise, then kita akan measure kita punya heart rate. Okay, measure heart rate. Bila heart rate katakanlah kalau kita expect heart rate to achieve 120 for low intensity. So beyond tu dia dah kena reducekan dia punya intensity balik sebab dia tak boleh pergi lebih daripada intensity yang kita dah prescribe kepada patient tu. Okay, dia akan maintain for certain duration. Sebagai contoh, mungkin kita tengok dari segi untuk 2 minggu. Okay, 2 minggu, and then kalau macam let's say dia tak boleh progress kepada moderate intensity, kita akan maintain lagi that duration for another 2 weeks. Okay, so katakanlah kalau macam dia boleh progress, kita akan progress. Kalau tidak, dia akan maintain sampailah dia stable dan boleh progress to the next level. Untuk fitness level ni, kalau kita tidak ada progression, kita tidak akan dapat kebaikan yang maksimum lah, tak optimum. Dia just macam maintain kita punya blood circulation saja, tak ada improvement in term of dia punya fitness level ni. So that's why kita kena ada progression daripada low intensity kepada moderate intensity lah.
Okey, menarik. Sebenarnya ada soalan daripada penonton di luar. Okey, dia tanya pasal intragastric balloon, Prof. Adakah prosedur intragastric balloon ni selamat untuk dilakukan? Apakah kriteria yang perlu dipenuhi untuk menjalankan prosedur tersebut?
Okey, untuk
Intragastric
intragastric balloon kita kena tahu apakah itu intragastric balloon. Biasanya the balloon tu kita akan isi dengan saline. Saline, normal saline kita akan isi dan kita akan embeddedkan di dalam perut dan stomach tu. Okey, bila dia embedded, so perut kita akan jadi kembung. So hanya ada space yang sedikit untuk makan. So bila kita makan, so kita akan terasa kenyang. So maksudnya kita akan reduce calorie intake lah. Okay, and in long run dia akan menyebabkan reduce calorie dan juga penurunan berat badan. Okay, kriteria untuk intragastric balloon macam yang saya mention tadi is either kita punya BMI more than 40 kilogram per meter square ataupun those who are more than 35 with comorbidities. Ada banyak comorbidities, sakit jantung, apa-apa, diabetes apa semua yang teruk. So boleh menggunakan this prosedur jugalah. Tapi assessment perlu dijalankan terlebih dahulu lah, nak tengok sama ada pesakit itu sesuai ataupun tidak dalam penggunaan this type of treatment. Lagi satu, in term of balloon tu kena beli balloon juga. So it's quite cost jugalah. It's a cost jugalah.
Okey. Terima kasih, Prof. Okey, ada satu soalan. Orang Malaysia ni lah, Prof. Biasanya dia suka skip. Jadi contohlah kalau seorang yang berpenyakit obes ni dia nak jalankan rawatan tapi dia nak skip rawatan-rawatan yang awal ni. Dia buat assessment juga tapi dia tak nak macam physical exercise ke, dia tak nak sangat. Dia nak skip terus pergi surgical. Macam mana, Prof? Boleh ke? Biasalah dia nak cut semua kan. Nak buat op terus lah.
Dia nak cut kan. Okay, so basically untuk yang morbid obese tidak ada masalah. Okey, sebab dia akan menyebabkan penurunan dari segi berat badan, tetapi faktor benefit lain dia tidak akan dapat. Sebagai contoh kesihatan jantung dan kesihatan metabolik. Bila seseorang itu menjalani physical activity, okey, badan akan menggunakan oksigen, jantung akan mengepam darah ke seluruh badan. So bila ada pengaliran darah ke seluruh badan, jantung akan bekerja lebih keras, so akan menyebabkan kesihatan pada jantung, cardiovascular benefit ataupun cardiovascular health. At the same time, bila ada physical activity tadi, kita punya muscle akan menggunakan glukos. Insulin akan bekerja untuk menggunakan glukos tadi dan masuk ke dalam sel-sel untuk dibakar lah dan semua kan. So in this perspective, bila kita buat physical activity, dia akan dapat benefit of cardiovascular benefit dan juga dari segi kita punya metabolic benefit. So kan kita cakap tadi, kalau seseorang tu ada obesity, tendensi untuk dia dapat penyakit jantung, penyakit kecil manis is very high, diabetes is very high. So bila kita buat this physical activity, it helps to reduce the complication of obesity yang kita cerita tadi lah, kan, semua-semua tu. So it helps to reduce. So that's why kalau kita buat bariatric surgery, memang berat badan tu akan menurun, tetapi itu dari segi body image sahaja. Tetapi dari segi health, cardiovascular health, metabolic health tidak ada. So basically most of the time, that's why kita selalu cakap dekat pesakit, bila kita buat diet control, diet terapi, kena juga buat physical activity supaya kita dapat maintain kita punya cardiovascular health dan juga metabolic health. So exercise is important component for everybody, bukan untuk orang obese saja. Untuk kita yang tidak mengalami masalah obese pun it's actually very good, because physical activity membantu kita untuk memantapkan lagi kita punya fitness dan juga dari segi kesihatan jantung dan juga kesihatan metabolik kita. Metabolik tu bermaksud dari segi glucose level, kolesterol level, dan juga hormon-hormon yang badan kita produce lah every day. So physical activity is very good to maintain that dan juga to improve lah.
So nak tak nak memang kena
untuk
memang kena buatlah physical activity tu.
Betul, sebab ada kesan baik yang lain, benefits, ada type of benefits lah.
Ya, betul. Okey, kita ada soalan daripada Puan Mahadevi. Prof, how about cool sculpting or fat freezing? Fat freezing or cool sculpting.
cool sculpting, fat freezing. Okay, I'm not very familiar with this process, tetapi yang penting sekarang ni, if you talk about macam obesity, macam yang moderator dah mention tadi, what is obesity? Is excessive accumulation of fat cell. Okay, whatever you do, you freeze ke apa-apa semua, the fat cell tu sendiri is actually metabolically active. Dia metabolically active, dia menghasilkan banyak what we call it as this chemicals. Sebagai contoh macam oxidative stress punya components, okay, dan juga those who are pro-inflammatories. So sesiapa yang mengalami banyak fat cell ni, adiposity, high adiposity, obesity ataupun high fat cell, lagi banyak dia punya oxidative stress materials di dalam badan. Bila banyak of this fat cell, so badan akan kemungkinan akan activate into other type of non-communicable disease lah, yang disebabkan oleh this oxidative stress. So in that sense, what we need is actually we need to reduce this fat level, regardless of what what methods we can do. Fat freezing maybe boleh, tetapi in terms of dia punya metabolically healthy cell tu macam mana, because dalam obesity dia ada two type of cell, is either brown tissue ataupun white tissue. So we need to actually look into that perspective jugalah. So maksudnya kalau kita reducekan kita fat cell, yes, it's okay, tetapi how active is our cell in the body to act lah. Maksudnya yang kita pergi refer balik kepada metabolic healthy tadi, metabolic punya kesihatan.
Okay. Okay. Soalan terakhir, Prof. Saya rasa.
Okay.
Apa saranan Prof pada mereka yang punya BMI dia borderline lah. Dia masih normal, nak dekat-dekat ke hujung-hujung normal, nak masuk ke overweight ni. Mungkin yelah, muda lagi, selera makan, orang cakap makan je lah kan, sementara selera tu ada kan, dah sakit kan, susah nak makan. Saranan Prof macam mana?
Okay, saranan. Okay, because basically those are in borderline from normal weight to overweight. So over time, because kita tengok kita punya masyarakat, our culture, Malaysian is sangat kaya dengan makanan yang sedap-sedap. It's not only sedap, tetapi it's actually high calorie. Okay, so every day bila kita makan, kita kena consider pemakanan kita, sebab over time this high calorie akan menyebabkan kita punya body weight daripada normal weight memang akan pergi ke overweight, dan kalau kita tak control, memang kita akan masuk ke obesity punya kategori. Kita perlu ingat bahawa sebenarnya, because if you talk about obesity, it's accumulation of adipose tissue. Adipose tissue dia akan berkumpul. Mungkin, maybe not in 2 years, maybe 5 years, 10 years, kita akan dapat this masalah of high adiposity. So, bila kita dah mencecah kepada high adiposity punya kategori, macam yang saya cakap tadi, banyak radikal bebas, banyak oxidative stress akan berlaku di dalam badan, dan badan akan start mendapat penyakit-penyakit non-communicable disease seperti high cholesterol, okay, impairment of glucose control, dan juga penyakit-penyakit jantung, penyumbatan pada salur darah jantung because of pemakanan tadi yang not healthy, high calorie, dan juga kurangnya physical activity. So to those who are already in the borderline type, you need to start controlling your diet, and juga engage in physical activity, not necessarily exercise, but more physical activity supaya ada blood circulation untuk membantu kesihatan jantung dan juga kesihatan metabolik tadi. So disarankan kepada semua orang untuk lebih aktif dan juga jaga pemakanan, because dalam situasi kita sekarang di Malaysia, makanan yang high calorie, so we need to look and see apa jenis makanan yang kita ambil lah. Itu sajalah saranan saya.
Terima kasih, sangat berguna untuk diri saya sendiri sebenarnya. Jadi saya rasa masa pun dah macam beri. Terima kasih Prof banyak sebab sudi luangkan masa dengan untuk hari ini. Sudi kongsi-kongsi maklumat dengan kita. InsyaAllah berguna untuk kita. Dan jadi sekurang-kurangnya kita tahu bahayanya penyakit obesiti ni, dan macam mana pun ada jalan penyelesaian untuk penyakit obesiti ni. Cuma dari awal lagi kita ada langkah pencegahan sebelum jadi benda yang lebih tak elok lah. Jadi terima kasih sekali lagi Prof sebab sudi luangkan masa. Jadi macam saya cakap awal tadi, kita ada 2 soalan kuis. Okey, saya akan bacakan 2 soalan kuis. Jadi kalau ada yang dah sedia, nanti jawapan dia boleh hantar ke Facebook direct messenger cardiology_UMMC. Jadi saya nak bacakan soalan, ataupun nanti soalan akan appear dekat Q&A. Dekat chat. Okey, soalan yang pertama. Health benefit have been reported with body's weight loss of how many percent? Health benefits have been reported with body's weight loss of how many percent? A, 2%, B, 5%, C, 7%, or D, 10%. Soalan yang kedua. The amount of physical activity that needs to be performed by an individual to gain health benefit and to prevent weight gain should be at least. The amount of physical activity that needs to be performed by an individual to gain health benefits and to prevent weight gain should be at least A, 15 minutes or more 3 to 5 days a week, B, 30 minutes or more 3 to 5 days a week, C, 15 minutes or more 5 to 7 days a week, or D, 30 minutes or more 5 to 7 days a week. Jadi kalau ada jawapan, hantarkan ke cardiology_UMMC. Okey, jadi insyaAllah esok kita ada satu lagi slot terakhir untuk sesi webinar. Esok kita akan bersama dengan sahabat saya untuk satu topik yang best, iaitu tentang stres. Jadi esok kita akan bincangkan tentang stres. Terima kasih sekali lagi untuk hari ini. InsyaAllah esok kita jumpa semula. Jika ada salah silap, saya mohon maaf. Dan saya akhiri dengan wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi taala wabarakatuh.